Welcome to the Bioscan Hub channel. If you find this helpful, please don't forget to subscribe. It really helps us out. Today, we're going to zoom in on the absolute workhorse of our bloodstream, the red blood cell. It's a cornerstone of the complete blood count, and for any of you heading into a career in the medical lab, really truly understanding this one tiny cell, well, that's your first giant leap. So let's break it all down together. So here's our game plan. We're going to start with the cell itself. What is it and what does it do? Then we'll look at the three main ways we measure it. From there, we'll dive into what it means when those numbers are too high or too low, put on our detective hats to figure out why, and finally, confirm everything with our own eyes. It's the whole diagnostic journey, right from a single number to a crystal clear picture of a patient's health. All right, first things first. Before we can make sense of any lab report, we have to get to know the star of the show, the red blood cell. Okay, so let's meet the erythrocyte. Now, there are two words here that are absolutely critical. First, it's non-nucleated. That means it actually gets rid of its nucleus to make as much room as possible for its real cargo, hemoglobin. And second, it's a biconcave disc. Think of it like a tiny, squishy donut without the hole punched all the way through. That unique shape? It's no accident. It is a masterpiece of functional design. And this is where that design really shines. It's all about form following function. That biconcave shape, it dramatically increases the cell's surface area, which means oxygen and CO2 can hop on and off incredibly fast. And because it's so flexible, this cell can literally fold and squeeze its way through capillaries that are narrower than the cell itself. Its entire structure is purpose-built for one job: efficient gas delivery, period. So how do we actually check in on this massive, hard-working cellular workforce? Well, we start with three fundamental tests that make up what we call the core RBC panel. First up is the RBC count, and it is exactly what it sounds like. We are literally counting how many red cells are packed into one tiny little microliter of blood. This is our most basic, fundamental clue. Do we have enough? Too many? Too few? It all starts here. Next, we've got the hematocrit. Now, I want you to picture this. You take a tube of blood, spin it down in a centrifuge, and all the heavy red cells get packed together at the bottom. The hematocrit is simply the percentage of that tube's total volume that's made up of those red cells. So, you see, it's not a count of how many cells there are, but how much space they take up. It's really a measure of concentration. And finally, the most important player of all, hemoglobin. You know, if the red blood cell is the delivery truck, hemoglobin is the actual container that holds the oxygen. It's the protein doing all the heavy lifting. Think about it. You can have millions of trucks on the road, but if their cargo containers are empty, the delivery fails. That's why a low hemoglobin level is so critical. It directly means the body's tissues are being starved of oxygen. Of course, none of these numbers mean anything without a baseline. This table shows you the normal reference ranges. You should think of these as your map. As a lab professional, you're going to get so familiar with these values you'll know them by heart, and you'll be able to spot instantly when a patient's results are off. And pay attention to the differences between the ranges for men and women. That's a critical detail you'll always have to keep in mind. So when the results from that Cora panel come back abnormal, they usually point us toward one of two major conditions. This is the first big fork in our diagnostic road. On one side, we have anemia. This is basically any condition where there's a reduction in red cells, not enough of them, not enough hemoglobin, or not enough volume. The bottom line is the blood's ability to carry oxygen is compromised. And on the flip side, we have polycythemia. That's the opposite problem, an abnormal increase in red blood cells. This makes the blood thicker, which can make it struggle to flow through the body. Okay, so let's say your core panel comes back low across the board. Low RBC, low hematocrit, low hemoglobin, the patient has anemia. Great. But that's not really an answer, is it? It's just the beginning of a bigger question. Is it from an iron deficiency, a vitamin problem, a chronic disease? To answer that, we need to dig deeper and look for more clues. And this is where we get to do the real detective work. We've identified the problem, anemia, but now we have to figure out the cause. And our primary set of clues for this investigation are called the RBC indices. These are calculations that give us a detailed profile of the average red blood cell. These indices are what let us go from just knowing that a patient is anemic to figuring out why. They tell us two incredibly important things about the average red cell in that person's body:
How big is it, and how much hemoglobin is packed inside? These are the clues that are going to help us crack the case.
Now, the most important clue of them all is the MCV, the mean corpuscular volume. This tells us, quite simply, the average size of the red blood cells. Are they too small, what we call microcytic? Are they too big, or macrocytic? Or are they just right, normocytic? This one number is our first and most powerful tool for sorting out the possibilities. Next up is the MCHC. Now, if the MCV tells us the size of the delivery truck, the MCHC tells us how full that truck is. A low MCHC means the cells look pale under the microscope. We call that hypochromic, because there just isn't enough hemoglobin packed inside each one. This immediately points us toward culprits like iron deficiency. And finally, there's the MCH, which measures the average weight of hemoglobin in each cell. To be honest, this number usually just follows whatever the MCV is doing. Smaller cells weigh less, bigger cells weigh more. It's an important part of the panel, for sure, but when we're playing detective, the MCV and the MCHC are the real heavy hitters. And this is how it all comes together so beautifully. Look at this. If the MCV is low, meaning we have a microcytic anemia, our list of suspects immediately shrinks to things like iron deficiency or thalassemia. If the MCV is high, telling us it's a macrocytic anemia, we start thinking about B12 or folate deficiencies. You see, the indices give us a clear, logical path to follow. The numbers from the automated analyzer are incredibly powerful, but in the world of hematology, seeing is believing. So the final, crucial step is to look at the cells for ourselves, directly on a peripheral blood smear. You can think of the blood smear as our final confirmation. The analyzer gives us the cold, hard data, the average size, the average hemoglobin, but the smear shows us the reality. We can see with our own two eyes if the cells are small and pale. And even more importantly, we can spot all kinds of weird shapes and structures that a machine would never be able to classify. And here are just a few perfect examples of what you might see. You can visually confirm that the cells are microcytes in iron deficiency. You might spot these distinctive target cells, which are a classic sign of liver disease. And of course, there's the unmistakable crescent shape of sickle cells, which is absolutely diagnostic for sickle cell disease. The smear provides the definitive visual proof. So we followed the clues all the way from a single cell to a full panel of numbers. We used the indices to build a profile, and then we confirmed it with our own eyes. And all of that leads to the most important question of all. What's the key piece of information you need to communicate? Because it's not just about finding the data, it's about telling the story that the clinical team needs to hear to actually help the patient. That synthesis, that's the real skill you're here to master. Thank you so much for joining us for this explainer here on Bioscan Hub. Understanding the red blood cell panel is truly the bedrock of hematology. Mastering these concepts now will serve you for your entire career. We'll see you next time.